Why do implants hurt? Why would an implant hurt? What makes it a painful process? And I think that's probably one of the things most people think about when they're contemplating if I'm gonna replace a missing tooth with an implant is, you know what, having a screw drilled into my head, not into that, so not gonna get an implant. So they go without a tooth there because the fear of the pain. That's part of it. And another part might be that you're not aware of the damage that's caused when you don't have a tooth where you used to have one. Obviously there's going to be some shifting, and then there's going to have, so the tooth behind will shift forward and the tooth above will shift down. So those are the two kind of main things that happens when you are missing a tooth. The other thing that might occur when you're missing a tooth would be the imbalance. So I relate it to like a vehicle. If you had an 18-wheeler truck going down the highway and I took away a couple of the wheels, it would still get down the highway just fine, as long as they're obviously not the front two that steer. But if I took them away, it would still be able to transfer the load. Now, if you take that same vehicle and fast forward 10, 20 years without having that balance, there's gonna be a lot of problems, abnormal wear and damage to the structure of the vehicle. Our mouth is no different. So if we're missing teeth, there's gonna be a real concern, a real issue with the balance and health of our existing teeth. So there's kind of a case for why you would want to replace a missing tooth. So they're kind of holding off on maybe getting an implant because of fear, or you're not fully understanding some of the consequences of missing a tooth. We'll also show how I can help you significantly here at Innovative Dental to avoid the pain commonly associated with an implant procedure. So to help explain that, when you typically are placing an implant, you would be placing it with a freehand approach where you're visualizing the tissue and you're going to place the implant with just vision and feel. And when you do that, you're going to have to obviously be able to see what you're placing your implant into. So the dentist, oral surgeon, periodontist, whoever's placing that implant is going to make an incision on the ridge of your bone, and they're going to reflect back the tissue. When they reflect that tissue away from your bone, now that tissue obviously has to re-heal back to the bone. That is why the post-op discomfort and pain from an implant might be so severe. It's why you might want to have a procedure where you're sedated, you're put under, because it's going to be a longer process, it's going to be more invasive, and then the recovery is more painful. So Innovative Dental prides ourselves in using the latest technology and techniques to help avoid these things that are really keeping people from experiencing the benefit of modern day dentistry. So, and obviously replacing the tooth and getting healthy. So this piece of technology right here, pretty slick, right? You can put your head in the middle of this and it rotates around. You may have seen something like that at your dentist. And maybe your dentist does have this, but most don't. That device might be called a Panoramic Xray. It really just takes a two-dimensional picture of your jaw. This is a three-dimensional image. So much like a CAT scan that you might get at a medical facility, this can take a one-pass image and get a 3D image of your jaw. The 3D image that we can get with this machine is allowing us to visualize the bone. And now that we can visualize the bone, there's no need for that incision. No need for the incision means next to no bleeding during the procedure. We literally make a small little tissue punch, something similar to like a 3-ring binder. So if you've ever seen one of those, little punch like that, it's about that big, and it's about that small, and it works perfectly at giving us access to place the implant. Since we already know what the bone looks like, we can use a guide to place that implant exactly where we want it with precision, safety. It's very quick and it's painless. And you're gonna be like, painless? Come on, man, you can't place an implant painless. Well, if you may or may not even need Tylenol that evening, I would consider that painless. And for most of our patients, almost all of our patients, that is what they will explain as their experience. After doing over 450 implants, I can tell you with certainty that our patients experience next to no discomfort, post-op pain, because of this process of guided implant placement. So hopefully this was useful. Implants can hurt, but they don't have to here at Innovative Dental. Well, I hope this video was useful and helps you understand how we can help you with your smile and take away the pain often thought and associated with getting an implant. If you'd like to see more of what we are about here at Innovative Dental, please give us a call at 417-889-4746. You can also go to our website at idspringfield.com. We would love to communicate with you on our Facebook or YouTube page. You can leave a comment. We'd like to hear more about if this is helpful or what other interests you might have about some more video topics that might help you understand dentistry. And be sure to like and share this so that more people can be educated on what would help them with maybe a missing tooth and an implant provided by Computer Guided Implants at Innovative Dental.